Hello everyone, this is Dr. Meenakshi Gupta. Today I am going to discuss another topic of pharmacology, that is drugs for cough. So what is cough? Cough, it is a sudden, involuntarily and protective reflex. ठीक है, ये क्या है आपका sudden है, then it is involuntarily and protective reflex, which is due to the stimulation of chemoreceptor or mechanoreceptor in the respiratory passages. It is going to involve the central nervous system, peripheral nervous system and bronchial smooth muscles. So as I told you, it is a protective reflex, so it is going to remove if there is any foreign material or if there is any mucus plug or anything. Okay? So always remember one thing, cough, it is a symptom. It is a symptom, not a disease. So how to treat the cough? If you know the cause, because already I have told it is a symptom, it is not a disease. So if you know the cause of the cough, treat the underlying cause. Treat the underlying cause. So the most common cause of acute cough which lasts for more than 3 weeks is viral respiratory viral infection. What could be the other causes of the cough and how you are going to treat that? So other causes of the cough, other causes and how we are going to manage that. Okay? So if cough is because of upper respiratory tract infection or lower respiratory tract infection, you give the appropriate antibiotic. ठीक है, आप ये दे दो. If the patient is having any asthmatic cough, ठीक है, अगर patient को asthmatic cough है, then you give the beta 2 agonistic drug, right? If the patient is having any sinusitis or allergic cough, then you give antihistaminics. ठीक है, plus decongestant. Same if allergic rhinitis, then also same. And if the patient is coughing because of pulmonary tuberculosis, then give anti-tubercular drug, ATT, anti-tubercular treatment. You have to put the patient on that. And if the patient is having any lung disease, this is bronchitis hai, bronchiectasis hai, then you give treatment accordingly. Okay? If the patient is having GERD, gastroesophageal reflux disease, give the patient proton pump inhibitor. And perchance, if the cause of cough is any drug, suppose the most important drug is, yes, anybody? The most important drug which causes the cough, that is angiotensin converting enzyme inhibitor, like enalapril, captopril. So here you replace this drug with angiotensin receptor blocker drug. So this is how you are going to treat the cause. If you know the cause of cough, you can treat. Then depending on the type of cough, you have to give the treatment. So how many type of coughs they are there? It can be, so cough can be, it can be dry cough or non-productive, and this is also called useless cough. See, cough, it is a protective reflex. It is going to remove if there is any foreign material or if there is any mucus plug. So it should not be suppressed. But many a time, if it is a non-productive or useless or dry cough, then what will happen? It is going to annoy the patient. And if the patient is having any undergone any surgery or any other problem, then such type of cough should be suppressed. So that is, one is dry cough and another one is productive cough. And this is a, we will say, useless cough, and this is a useful, because it is going to try to remove the all the secretion, useful cough. So how we are going to treat this dry cough and how we are going to treat the productive cough, sorry. So for the dry cough, we are going to put the patient on demulcents, okay? We are going to put the patient on demulcents. How they are going to act? They are going to cause a soothing of the throat. Demulcents में क्या आता है? Just like आपकी, like you can say linctuses, cough syrups, licorice. So इसमें आपके क्या आते हैं? Cough syrups, cough drops of syrups, linctuses, lozenges, licorice, glycerin. So they are going to cause, how they are going to act? They are going to produce a soothing effect. So if there is any inflammation in the throat and that is going to take the impulses, so it is going to suppress those. By this group of drug, they are going to act. इसमें आपके जैसे lozenges में just like a Vicks, the Vicks की गोली. So it is like that. So the another is group of the drug is antitussive. Antitussive is also called a cough suppressant. They are cough suppressants, and they can be of further opioids, non-opioid, or can be adjuvant. So with the opioid, we have a opioid like a morphine type of drug. So here what are the all the drug we have? We have codeine, then codeine, and then further we have ethyl morphine. So these are the three drugs which comes under opioid. Now codeine, it is obtained from the opium, ठीक है? Opium alkaloid वहाँ से आती है. So just like morphine, it is less potent. But morphine, why we don't use morphine? Because morphine, it has got the addiction liability. It causes the respiratory depression. Whereas codeine, it is more specific for the cough. It doesn't have that analgesic action is not there. Then at higher doses, very higher doses, it can suppress the respiratory center. And once you give, it is going to act for 6 hours. But the side effect with this is, I'll use another page. So codeine, it is a opium alkaloid. Okay, so more specific for opium alkaloid, more specific for the cough, and if you are going to give, it is going to act for 6 hours. No addiction liability, no analgesic action, no addiction, no analgesic, and less potent than morphine. It is a less potent than morphine, right? And higher doses it is going to, at higher doses, it is going to cause the respiratory system depression. And what are the side effects with this drug? The most common side effect with this is a constipation. And if we take the Folcodeine, the another drug, Folcodeine, it is just like a codeine. The only thing is the duration of action, that is 12 hours. Here it is 6 hours. यहाँ पे कितनी है? 12 hours. Then another one is ethyl morphine. Now ethyl morphine is just like a codeine. Codeine, what is chemically it is? It is a methyl morphine. बस इतना ही फर्क है. ठीक है. So all the action of ethyl morphine and this codeine, which is a methyl morphine, it is same. The only thing is the side effect, that constipation, it is less with this. So this is about the opioid antitussive. Now under the non-opioids we have the two drugs. One is noscapine and another one is dextromethorphan. Now noscapine, it is a again use this side. So noscapine, it is a opioid which is obtained from benzoisoquinolone series. ठीक है. इसमें भी क्या है? The addiction liability, that is not there. Big no. Analgesic action, not there. It is going to suppress the cough. It is used for that. And here the main is it causes the release of histamine, which can cause the bronchoconstriction. So side effect can be, other side effect, nausea and headache. Then another group of drug, that is dextromethorphan. This is NMDA receptor antagonist. Its L isomer has got the analgesic action and D isomer, that is going to suppress the cough. And this drug, its important side effects are nausea, drowsiness, dizziness, and sometimes ataxia. So these are non-opioid antitussive, noscapine and dextromethorphan. Now under the adjuvant, what all we have under the adjuvant antitussive? Under the adjuvant we have antihistaminics and bronchodilators. So under the antihistaminics, what all we have? Chlorpheniramine, promethazine, ठीक है? And the second generation antihistaminics like loratadine हो गया, fexofenadine, that is not used. Now how the antihistaminics drug, they are going to suppress the cough, how they are useful in the cough. See, antihistaminics, they have two important property. One is anticholinergic action and another one is sedative. So इसमें क्या है आपका anticholinergic action and sedative action. So because of that, it is going to help in cough, and rather it is going to the mucociliary action of the mucosa, respiratory mucosa, that action it is suppressed because of this. So it causes the drowsiness, sedation है ये. So the person will feel very sleepy. Then bronchodilator. What happens many a time because of the irritation in the pharyngeal mucosa, that is going to cause a cough as well as a bronchoconstriction. If that component is there, then for that particular cough you have to use the bronchodilator. So bronchodilator always use when the bronchoconstriction component that is there. So what bronchodilator we can use? We can use beta 2 agonist drug, then theophylline. So usually it is a beta 2. Remember, it's a beta 2 agonistic. So with the many of the cough syrup, this combination, fixed dose combination, they are marketed with this. Then, so this is all about the drugs for the dry cough or non-productive. So most important for the drug for the dry cough, I again revises for the dry or non-productive cough, the two group of drug they are there. Demulcents, it is E here, demulcents and antitussive. Demulcents may they are going to produce a soothing effect, whereas antitussive they are the cough suppressant, and under the antitussive we have opioid, we have non-opioid, and then we have a adjuvant antitussive. So with the adjuvant antitussive we have antihistaminics and the bronchodilator. Now coming to the productive cough or a useful cough, what all drug we are going to put the patient on for the productive cough. See? So for the productive cough, we have the two type of drug we are going to put the patient on this. One is expectorant, which is also called a mucokinetic, and another one is a mucolytics. Okay? So mucokinetics में क्या है? Mucokinetics they are going to increase the bronchial secretion. Okay? So what all come under this? I'll use another page. So mucokinetics or expectorant. Under this comes your sodium or potassium citrate. So expectorant we have sodium and potassium citrate. So they are going to induce the thin copious secretion by salt action. Okay. Then we have a potassium iodide. So it is secreted in the bronchial gland and they are going to irritate the mucosa. By that it is going to increase the bronchial secretion. But it may cause iodism, it may alter the thyroid function, so it is not used nowadays. So another expectorant we have guaifenesin. Okay, and this is also secreted in the tracheobronchial gland, and by that it is going to increase the secretion. So these three, they are the expectorant. This is very commonly used presently, guaifenesin. So one group of the drug for the productive cough, that is a expectorant or mucokinetic. So another one is we have a mucolytics. So what we have under this mucolytics, we have a bromhexine. So this is an alkaloid which is alkaloid vasicine obtained from the plant Adetoda vasica. So important point this one is it has got both the property of this mucokinetic as well as a mucolytic. So it is going to induce the thin mucus bronchial secretion. So mucokinetic action bhi ho gaya, and mucolytic hai, they are going to break down that thick mucus. So how it is going to, it is going to cause the depolymerization of, or it depolymerizes the mucopolysaccharide. directly. Mucopolysaccharide bond in the sputum directly, and another one is by inducing the secretion of or by liberating the lysosomal enzyme. So it is going to cause a depolymerization of the mucopolysaccharide of the sputum directly or by liberating the lysosomal enzyme. So whatever that thick sputum, it is going to make it less viscous or make it thin so that it can come out easily. Here important side effect, they are the gastric irritation, then there can be lacrimation, there can be rhinorrhea. So one is a bromhexine. So second one is a ambroxol. So what is ambroxol? Ambroxol, that is a this metabolite of bromhexine, sorry, metabolite of this bromhexine. So all the things ambroxol, all the properties, they are same as bromhexine. Then another mucolytic, that is acetyl cysteine. So how they are going to act? They are going to open up the disulfide bond. Okay, जो disulfide bond है in the sputum, it is going to open up that. So by opening that disulfide bond, it is going to make that sputum less viscous and thin, so that it comes out easily. So we can give it by the oral tablet, इसको दे सकते हैं, nebulize करवा सकते हैं, and if an intubated patient, we can put it directly into the respiratory tract. So important adverse effect acetylcysteine से क्या है? It can break down that gastric barrier. So if the person with the peptic ulcer, उसमें you have to be careful. Another drug is carbocysteine. This is just like a acetylcysteine. The same way it is also going to act. Important adverse effect here also, it can precipitate the peptic ulcer. It also break down the that gastric barrier. So this group of the drug mucolytics, where we are going to use if the person is having any you can say asthmatic bronchitis, tracheostomy patient, and if there is a thick mucus plug that is there, so in that kind of the patient, it is going to help. So that's all about the drugs for the cough. What kind of the question you may get in the this topic? So as a short note, you may get a drug for the cough, drug for the dry cough, drug for the productive cough. As a mucolytic can be asked as a short note, and antitussives can be asked as a short note. So if you like my video, please subscribe my channel and put up your important comments in the suggestion box.